Assalamu alaikum warahmatullah. My name is Aseel, and today I will present my individual project of EE 472 course imaging system. In this slide, as shown, the table of content. First topic is the risk and hazard of ultrasound exposure, and second one, imaging artifact. Ultrasound imaging, as known as also by sonography or diagnostic medical sonography, is a medical method that uses high-frequency sound wave to produce the imaging of structure within your body. The image can provide a variable information for diagnostic and treatment variable of diseases and medical condition. When we talk about ultrasound, we must mention the ability of hearing ultrasound. The upper frequency limit in human hearing is approximately 20,000 kilohertz, a limitation of middle ear, which is act like a low pass filter. Ultrasound hearing can accurate if the ultrasound feed directly into the skull bone and reach to the cochlea through the bone conduction, without passing through the middle ear. The human hearing tends to become lower with the age and passing the years. Ultrasonography is generally considered as safe way and method to image the whole human body. It's harmless and without any risk to the patient. World Health Organization technical report says the diagnostic ultrasound is recognized as safe, efficient, and highly flexible way to image the body. Using the principle of LARA, which is known as low as reasonable achievable, that means we use the ultrasound as much as we need with the ability to examine the part that we need. There is some evidence that even with the modern devices, which are designed in accordance with international standard and regulation, can warm up the tissue to unwanted degrees under some circumstances, which can cause unwanted burn of tissue. If gas bubble were an ultrasound field of the tissue that may cause and tissue damage from the stress. For ultrasound imaging equipment for the modern design, they can display safety indicates that give the user feedback so that can be safer to use it. Now we'll talk about the second topic, which is artifact in ultrasound imaging. The term imaging artifact refers to any features in the image which do not correspond to actual tissue structure, but rather to error introduced by the image technique or instrumentation. Such artifacts must be recognized to avoid incorrect image interpretation, but once recognized, can in fact give us a useful diagnostic information. There are several other artifacts that can appear in ultrasound imaging. For example, we mention here reverberation, which is accurate if there is a very strong reflector close to the transducer surface. Second one is multi-reflections, which is kind accurate between the surface of transducer and the reflector. These reflections appear in a series of repeating lines in the image. Another identification for the artifacts are the relatively simple to detect due to the equidistant nature of the line. Typically, they are accurate when the ultrasound beam encounter regions of either bone or air. Costing enhancement accurate when there is an area of low attenuation relative to surrounding tissue, and therefore the structure lying deeper and aligned with the area show artificially high signal intensity. For example, seeds. The opposite phenomena, the term of acoustic shadowing, which is accurate when the highly attenuating medium result in the dark area, deeper below the highly attenuating medium. For example, the solid tumor. In this slide, we have this picture showing the artifacts that caused by the acoustic enhancement and the acoustic shadowing. In the right, we have acoustic shadowing, and the left, we have the acoustic enhancement. Moreover, in this slide, we shown the common CT image artifact which is a streak artifact, motion artifact, beam hardening artifact, ringing artifact, and bloom artifact or material artifact, as shown in the left picture.